So for this part, we're gonna have you keep your eyes open.
Okay.
And off the table, just like you're talking to your best friend over here, okay? So we'll
I'm just
clean
scared
your
of seeing the
skin.
needle. That's why I close my eyes.
Oh yeah.
Okay.
Because if you close, it'll scrunch up your cheeks.
Okay, I understand. Sorry, I'm like
Okay,
trying to be.
So we'll start at the little tiny drop right here because I feel like her cheekbone needs a little more volume or body. So I aspirated first, and then I put in 0.075 cc's, usually in each area. And I just march over here towards her nose using those little tiny doses of 0.075, and you inject very slowly because complications occur if you inject quickly, and there's no hurry. So you always use a TB syringe, never use the syringe that comes with the filler because it's too big. And then always massage and use your pressure to prevent any sort of swelling or bruising, because bruising won't occur if there's no bleeding, and there will be no bleeding if you immediately apply pressure right after the injection. So you just go slowly, and now we're going to move downward a little bit because in her, she has volume up at the orbital rim, but in the mid cheek is where I really feel like she needs some volume. So we're going to give her a really nice arch for her cheekbone. In a perfect world, you want to do as few needle sticks as possible, because if you just think every needle stick is not only a potential bruise, but every needle stick just means more swelling. So try and get the job done with as few as you need, but at the same time don't not get the result because you don't want to keep going. And that looks great so far. Move back over here. You doing okay? Am I hurting you?
Oh, it just doesn't hurt as bad as the lip, so that's a win.
Okay, good. Kind of thought that might be the case.
You started out with the worst.
That's right, always do. Okay, I'm gonna move up here towards her zygomatic arch because she can really get some lift and it'll really feather out the cheekbone. So I usually kind of start around the mid-pupillary line, work my way inward, and then feather it out laterally. That's just my preferred technique. So this is looking very nice already and natural. There's just a little area where we need to feather it out again. And then in a minute we'll use some Aquaphor to massage, and she'll be finished. Okay, very good. Let's put a little Aquaphor on here. Okay, now for this part, we'll move your, we'll rest your head back, please, and then we'll massage. Beautiful. Now, let's compare the two and see how beautiful she looks. Can you see the difference? So this side, she's a beautiful cheek and cheekbone, and she's lifted. And on this side, you know, we have just a little bit of area here where we're gonna add some volume in a minute. Okay, thank you.